Well, I am the Director of Outpatient Clinical Services here at Behavioral Health Specialists. I am also a provisionally licensed psychologist, and therefore I see clients both on an individual basis as well as in a group environment, and have also been doing psychological evaluations, and will begin to do social security determinations and those evaluations for that. I have loved working with people for a very long time, and from the age of 13, 14, I really wanted to be able to help people in some avenue, and took a psychology course in high school and loved what I learned about psychology at that point, and decided I wanted to pursue that in college. I started my bachelor's degree at Wayne State College and did receive my bachelor's in psychology and sociology. And I took a break for a short period of time before starting graduate school at Wichita State University in Wichita, Kansas. That is a clinical psychology program. So I received that degree in 2007, and from there had to complete a predoctoral internship as part of my programming, and did that at Whitfield State Hospital, or Mississippi State Hospital in Whitfield, Mississippi. In a typical day, I tend to have a couple of roles. One as the Director of Outpatient Clinical Services, and the other as a provisionally licensed psychologist. So someone who was full-time working as a psychologist would maybe have a little bit of a different day, but my day involves supervision of other clinicians that may be bringing in cases that they're having difficulties with, and we brainstorm some ways they could better serve them. I'm also going to be seeing clients individually, usually 2 or 3 a day myself, and then also may do a group exercise later on in the evening. We have several groups that go on throughout the week, and I'm involved in that very much. Thoroughly enjoy doing group work. And so my day of client time may include individual work, group work, and then also working with clinicians on how to better serve clients. There's going to be several individuals in the room, and they are going to be processing treatment issues amongst themselves. And when a clinician is doing group work, their primary role is as a facilitator, not as an individual who would do one-on-one therapy with several people in a group setting. So it's beautiful to be able to see that clients can start working together, confront each other, and can really come up with a very better understanding of themselves by working with each other instead of just one-on-one with a clinician. They're giving back as well, so it's not just learning about themselves, it's also being able to give some of their skills back to another person. So it can be very gratifying for clients to be in a group setting and be able to be a more senior member in a group and be able to give advice to maybe some early or some newcomers to a group. Well, in my high school, the only opportunity really was the introductory psychology course, but there are a lot of other things that you need to be thinking of. When you think of things like a speech class, that's going to be very important, because you are going to have times where people in the community are going to ask you to do a lecture, or are going to ask you to come and do a training of some sort. So to be able to be a good speaker and be confident in being a speaker is going to be very important. Also, sometimes in just sitting with a client individually, if you don't have a lot of confidence or a lot of ability to convey your message, then the client's not going to really feel like they're getting as much of a service. And so being a good speaker, learning how to present yourself, and learning how to be assertive are going to be very valuable tools to have and to learn in school. So that could come through many avenues. It may come through being involved in an extracurricular activity, potentially sports of some type, or a speech group, debate team, any of those kind of things that could build confidence and would allow someone to verbalize themselves in an appropriate way. I have found that patience is probably one of the biggest things that is needed, and that can be very difficult sometimes, even for someone who is a very patient person. But there's a lot of times that if you become too high-strung during a clinical interview or during a session, that individual is going to feed off of that energy. And so patience is very much a needed personality trait or characteristic, but also being genuine and not trying to give someone some fluff about what's going on, but being assertive and open and genuine with that person, and not trying to be fake, just being who you are and comfortable with that. I think one of the most rewarding aspects of what I do is really being able to see children and adolescents grow. I love working with adults as well, but when I get to see a child actually grow up and get to see their relationship with their parents flourish, I have to say that's one of the most rewarding things. But on top of that, I also really enjoy working with people who have a dual disorder, which may be a mental health and a substance abuse disorder, and seeing them be able to, those clients, those individuals, be able to flourish by going through treatment, whether that's in a group setting or in an individual setting, and being able to see the families heal. Our group program is very much a family-oriented program, and there have been kids that have been able to come in with their parents and be able to go through that treatment program with them. And to hear children say, "I finally have my dad back," is a very powerful message for a family who's had an alcoholic father for several years. And so it's hearing those kind of messages and knowing that I haven't done all of the work, actually the client and the family have, but I've allowed the venue to make that happen. I think one of the most challenging things is to try and weigh what needs to be done right now. Obviously, I want to be able to see clients, I want to be able to help clients, but I also need to make sure you're documenting what you're doing, because if it's not documented, then it never happened. And sometimes those documents can be a very tedious task, but it's a very needed task. If you document appropriately, then you can basically start up the next session just where you left off. But if you haven't documented that session or you haven't documented that contact with that person, then you're trying to go by memory, and sometimes that's not the best strategy to take. But documentation can take quite a bit of time, and it's not, for me, as rewarding as seeing a client. For continuing education, and the status that I'm at right now as a provisionally licensed psychologist, my continuing education is the training and the supervision that I'm receiving until I'm fully licensed. Once I become fully licensed, then I have a certain number of hours of continuing education that I would have to uphold each licensure renewal time. And so it's every 2 years you would need to have a certain number of hours, and that's constantly changing. So it's best to always look at your licensure regs and regulations and see how many hours you need to have for continuing ed. I would encourage individuals to be introduced to not just the book side of things, but try and do an internship somewhere, or try and do a part-time job somewhere that would allow you to understand what you're learning in books with a human, with an actual individual, and ask them questions. I remember back in the day of not understanding what schizophrenia was really about, and working with an individual who was dealing with a significant amount of paranoia and auditory and visual hallucinations. And so I would ask the person, well, tell me about it. What are you hearing, or what are you seeing? You can't possibly get that from a book. You can't understand someone seeing a ghost-like figure from a book, but they could describe it to you in real time, in real life situations for them. Balancing your personal life and your work life can be very challenging from time to time, and it's the position that I'm in as the director of outpatient clinical services has a lot of responsibilities to it, and I don't have the luxury sometimes of being able to leave when I expect to leave, especially if there's an emergency. And so my husband is wonderful. I have to say, he does wonderful things with my son Lucas and is able to help me balance all of that. My husband has even been willing to change his hours at his job to be able to allow us to have more family time. And so it's a matter of being able to look at what are the needs of your family and what are the needs of your work, and talking with your supervisor about that, and talking with your family about that, and making sure that you're not trying to do all of these things in a vacuum. If you do and you're not utilizing your resources, it's a very high potential for you to burn out very quickly. And so it's very important to be talking to all of these different individuals about how can I balance all of this. Well, in the field of psychology, there is so many different avenues that you could go down. Again, I said I was a clinical psychologist, and there are many other psychologists. There's human factors, there's industrial organizational psychologists. So depending on what field, what specialty you want to go into in the field of psychology, there is a wide variety of things you could do. In the clinical field, it seems that there is an increase in the number of concerns that folks are having. Currently, there's a lot of stress financially for a lot of individuals, and so financial stress then can trickle into marital problems, and that can trickle into parents not being able to focus on their kids as much. And so it can lead to depression, it can lead to anxiety and other disorders, which can also then lead into physical health problems. Now, I can't predict what's going to happen in the future, but it seems that there is always going to be a need for folks to have someone that they can talk to about some very private matters.